Around the world, rabies accounts for about 150 deaths every day. Most of these are in Asia and Africa, with a vast majority of those in India, possibly a result of the large number of stray dogs that roam the streets there. In the United States, there are generally dozens of cases every year, mostly caused by bat bites. However, there have only been 1 to 2 deaths of rabies per year, a result of the post-exposure prophylaxis of the vaccines that Louis Pasteur initially developed. These post-exposure prophylaxis treatments must be done early on in the infection during the incubation period, because if given after symptoms start to arise, it is no longer effective. In 2004, a teenager in Wisconsin, Jenna Gies, made history after contracting rabies at the age of 15. She had picked up a bat and suffered a minor bite on her finger and received no medical attention for 3 weeks. Eventually, symptoms developed of the disease. It was too late for the PEP, or post-exposure prophylaxis, so her doctors, wanting to do something to help her, initiated what is referred to as the Milwaukee Protocol, an experimental treatment that is designed to hopefully help patients who are symptomatic for rabies. The Milwaukee Protocol includes placing the patient in a drug-induced coma and treating the patient with antiviral medication during the coma. After 7 days, she was slowly brought out of her coma, and after many months of rehabilitation, was able to overcome the rabies infection. Jenna is the first person known to have recovered from symptomatic rabies without receiving the rabies vaccine after exposure. However, in subsequent years, about 29 cases of rabies were treated with the same Milwaukee Protocol, with only 2 patients having survived. So while this initially seemed very promising, Jenna Gies is not considered to be a typical outcome for this experimental treatment. As mentioned, rabies is transmitted most often by an animal bite. This starts with an incubation period, followed by a prodromal period, where there are nonspecific flu-like symptoms and some tingling at the site of the bite. Then there's the secondary or illness stage, which is characterized by symptoms of anxiety, confusion, agitation, delirium, abnormal behavior, hallucination, drooling, and hydrophobia. Hydrophobia includes a fear of water, where the mere sight of water results in uncontrollable spasms in the muscles of the mouth and pharynx, leading to spitting and choking. It's thought that this hydrophobia is also what leads to foaming of the mouth, where animals and even people can generate amount of saliva in the mouth as a result of a lack of water. Eventually, the virus progresses along the nerves of the central nervous system and can infect the spinal cord or brain, leading to dumb rabies or furious rabies, respectively. The rabies vaccine that's currently in use involves multiple rounds of injections given in the arm. These are fairly painless injections and are different from injections given just a few decades ago, which were much more painful and given in the abdomen. Next, let's talk about Ebola. The Ebola virus is the cause of what was used to be known as Ebola hemorrhagic fever, but is now referred to as Ebola virus disease. It is named after a river in the African nation of Zaire, now referred to as the Democratic Republic of the Congo. The Ebola River was where this virus was first detected in 1976. The Ebola virus causes sporadic outbreaks of severe infections with a high fatality rate in humans, monkeys, and chimpanzees. This disease is thought to be primarily transmitted from animal to animal and thus is considered zoonotic, with the reservoir believed to be bats. Transmission occurs with contact with bodily fluids, though it can also occur by sexual contact because the Ebola virus remains active and present in semen for as long as 9 months after the patient overcomes the infection. There are 2 main stages of the Ebola virus infection. It begins with the dry symptoms, which include a fever, chills, muscle aches, headache, stomach pain, sore throat, and abdominal pain. This is followed by wet symptoms that include diarrhea and vomiting, particularly of blood. The blood in the body fails to clot, resulting in massive hemorrhages or blood loss throughout the body, both externally and internally, meaning the patient can have a lot of blood in the diarrhea, blood in the vomit, and blood can even be coming out of the nose, eyes, and ears. In addition, blood leaks underneath the skin and can cause massive amounts of black bruising with this leaking blood in the body. Control measures in a community or a hospital primarily require the barrier technique, where there's a use of gowns, goggles, masks, and gloves in order to prevent any exposure to any of the bodily fluids. Treatment primarily involves what's referred to as the best available supportive care, or BASC. BASC is palliative care, or care that treats the symptoms but not the disease itself, and focuses on providing the patient with relief from the effect of the disease. It involves balancing the patient's fluids and electrolytes, maintaining their oxygen status in their bloodstream, and also maintaining blood pressure, and any complicating infections that may emerge as a result. The 2014 outbreak of Ebola virus was one of the more recent and frightening worldwide. It all began when a 2-year-old toddler died from the disease in December 2013. This occurred in West Africa, and this small child was what we refer to as the index patient, or patient 0, the first patient to acquire the disease from the animal reservoir. It's likely that the boy had played with some bats who lived very near his home, or that he was infected by coming in contact with bat blood as the child's family hunted, grilled, and ate bats as part of their lifestyle. The toddler then, during the infection and after death, infected his sister, mother, grandmother, a village midwife, and nurse. None of these individuals, nor the healthcare workers that came to check in on and care for them, considered Ebola as the cause of this disease, because it was unfamiliar to the people of this region. The disease ended up also being spread through unsafe burial practices, which are common in this area of Africa, in which touching and washing the body of deceased relatives was a cultural practice to show respect to the dead family members. This led to infection of anyone who cared for these individuals. What made the disease even more widespread was that 5 months into the outbreak, it eventually spread to the capital of Guinea, a city with a population of about 2 million people. It was the first time in human history that Ebola infected such a densely populated region, one that also had an international airport and allowed the virus to potentially spread to other areas of the globe. The World Health Organization usually relies on what's referred to as contact tracing to identify potentially infected individuals by understanding who has come in contact with the sick. However, in a large city, such as the capital of Guinea, contact tracing becomes almost impossible. All of these factors combined into making this outbreak in 2014 the most widespread and deadliest Ebola outbreak in the history of Ebola. In fact, this epidemic was 11 times larger than all previous outbreaks combined. In particular, it hit healthcare workers hard. They were at the highest risk for contracting the disease by coming in contact with infected patients. There currently is no other treatment for Ebola virus infections, and there also is no vaccine, though research is underway for developing these for this disease. Our last section of this chapter, talking about viruses, is on arthropod-borne diseases. Arthropod-borne diseases are diseases that are transmitted by insects. These arthropod-borne diseases are primarily transmitted through mosquitoes and tick bites. With climate change, the range of mosquitoes and ticks is increasing as one of the main limiting factors of insects and their habitat range is temperature. The warmer the temperature, the more these insects can roam. In addition, extreme weather events are also a factor in spreading these diseases. These can promote the formation of small ponds where mosquitoes can lay eggs and reproduce much faster. Mosquitoes are, in fact, one of the best known disease vectors and can transmit infectious diseases between humans or from animals to humans. They do this when they take a blood meal by taking in viruses or other pathogens, and then when they go and bite the next host and take in a second blood meal, they transmit those pathogens to the next host. The first disease that we'll talk about is Zika virus. The Zika virus gets its name from the Zika forest, which is located in Uganda. It was first identified in the 1940s, but the first human case of Zika virus disease was reported in Nigeria in 1954. There were subsequent sporadic human cases of Zika virus found in Africa, the Pacific Islands, and Southeast Asia during the 1960s. The Zika virus recently emerged in Brazil at the end of 2014. It has symptoms that were similar to other mosquito-borne viruses, such as chikungunya and dengue fever. And so for a while, it was mistaken for other mosquito-borne diseases. But by the end of September 2015, there was a noticeable increase in the number of newborns with microcephaly, which is when a newborn is born with a head smaller than normal as a result of poor development of the brain. This is a severe congenital defect where children may have impaired cognitive development, delayed motor development and speech, facial distortions, seizures, and difficulty with coordination and balance. The newborn's eyes are often damaged as well, with ineffective joints and too much muscle tissue. Viral infection of Zika virus also is associated with Guillain-Barré syndrome, a rare disorder in which the person's immune system attacks the nerve cells of the body, resulting in muscle weakness and sometimes paralysis. Thankfully, Guillain-Barré syndrome is very temporary and can only last for a few weeks to several months. Only 1 in 5 people suffering from Zika virus infection are symptomatic, allowing Zika virus to spread much more readily. We'll continue talking about Zika virus and how it infected those in the United States in the next section.